is a Lorient element. It's a clinical experience and real-world outcome, which is easy and not really difficult session compared to previous one, because this is a topical compound, but it will have a significant impact on your clinic revenue. So you might take a look at this topic in terms of not the difficulty, but in terms of using this for other skin condition. Okay, let's just take a look of this company's Lorient element, because they made this really nice. There's a 5 ingredient, and there's a 500 atom rule, which I'll discuss later. That's how this comes. It's niacinamide, glutathione, tranexamic acid, and hyaluronic acid, vitamin C, ascorbic acid. So that is the only compound that this Lorient element has, and hyaluronic acid. And it doesn't have any preservative or other substances in this product. Like other topical cosmeceuticals, it only have these 5 ingredients: glutathione, ascorbic acid, tranexamic acid, niacinamide, and hyaluronic acid. So what is a 500 atom rule? It's 2002, I guess, 2000, right? They argue that molecular weight over 500 atom cannot penetrate the skin layer because of the 3 reasons. First is we have a skin allergen. Most of the allergen is below 500 atom. So the authors argue that the molecule should be below 500 atom to penetrate the skin. The second argument reason is that the topical drug that we use in the every clinical setting that is below 500 atom. And the third reason is the skin patch. The molecule size is also smaller than 500 atom. So the 5 ingredients here is all below 500 atom. So ascorbic acid, niacinamide 122, tranexamic acid 157, vitamin C 176, and glutathione 307. So the main use of this Lorient element is skin brightening and melasma. Because if you look at this ingredient, it's all for the skin brightening. Glutathione is well known for skin brightness, and ascorbic acid is also reduces photo damage, and tranexamic acid is reduce melasma, and niacinamide is also known for another substance for skin brightening. And there are well-known published data about the glutathione that it makes the skin brightening. An oral compound of glutathione can make skin brighter after oral administration. And this is the data that tranexamic acid, everybody knows that we use oral tranexamic acid for the melasma treatment. And this is data topical can have a better, compared to control. If you use a thulium laser with tranexamic acid, and the other side is a thulium laser without tranexamic acid, in the study group showed a better melasma result, improvement after tranexamic acid topical plus thulium laser. And this is the data that showed that tranexamic acid plus ascorbic acid compare. Both showed a significant improvement of the melasma condition. And there there's another data showing similar result that tranexamic acid compare vitamin C. Tranexamic acid showed a better result, but in terms of the pain, vitamin C had a better result in terms of the pain. So finally, niacinamide is also very well known for pigmentation disorders, and many cosmetic company uses this niacinamide these days for another alternatives of vitamin C. So I think we already know that these are really nice compounds to use for skin brightening. But the thing here is that we cannot inject this compound because it is not approved by Korean FDA to use in manual injection. I think it's that you have the similar situation here. So everybody think about how to deliver this molecule. So if you look at the topical first, the first column on the left, the bioavailability when you use a topical drug is usually less than 5%. If you look at the physiopathic dermatology, the hydrocortisone absorption rate is around 2.224%. And the other article, if you look at, is the topical drug usually have an absorption rate is 4 to 5%. So it's less than 5%. So many Korean dermatologists use like assisted delivery, the second column, microneedling or microneedling RF or something fractional laser. So it's a laser assisted delivery devices. If we use these devices, we can increase the absorption fold rate like a 10 to 100 fold. And if the third is manual injection, it's just 100% absorption rate. Everybody knows it. But the patient, what method the patient will likely to prefer? Maybe I think we are using a lot of Rejuven in Korea. But if we inject manually, we have a lot of bruise and bump, some angle. So everybody worries about the downtime. So nowadays, many patients prefer the second assisted delivery because it has no bruise, maybe downtime is less than 1 day. So now many people prefer the second way. So we are always consider which way is the better absorption, better result. Of course, manual injection is 100%. Of course, that will be better absorption. But if you look at this article, they show the split phase of tranexamic acid. One is intradermal injection, the other is a microneedling. And if you look at the result is comparable. So it's not really different, but patient satisfaction much higher with microneedling because the reason that I told you, no pain, less pain, and no bruise. So I think the second, the assisted delivery is very, very becoming important in Korea. Maybe I think it is the same situation all over the world. And Dr. Roh will discuss about the needle-free jet injector later on. But now I'm talking about the microneedling later. But before I move to that project topic, I thought I'll show you some photos of this element result. We have, I think that this one is a 3 years ago result. 17 sites, 17 dermatologists. And we used this element using multiple different devices, microneedle RF, sodium laser, and plasma. So 50 patients were enrolled, and the satisfaction was 9 out of 10. And I used many used the sodium laser and fractional picosecond, fractional erbium, and micrometer RF, and plasma argon ion laser. So this is the result. Of course, many really like the result, maybe because of this compound, also because of the other laser assisted delivery. So she became better. She had some redness before the treatment, but after treatment, the redness is gone. And some pigmentation were improved. Yeah, melasma got improved after the element uses. And this is Dr. Wee, courtesy of Dr. Wee. And here, the pigmentation became better. Also, the redness became improved. If you look at the texture, also got better after use of this. I think this is not just because of the element. If you use a fractional or microneedle RF, you get better texture after the treatment. Okay, the similar result. This one has a melasma, but melasma can be improved by this Lorient element and plasma treatment. And this one is sunburn after like a PIH after sunburn, and it also became better after cooling laser. Okay. This one is another microneedle RF that I'm using in my clinic. It has a microneedle RF plus syringe inside, so you can use at the same time. So if you use just one shot, gives you microneedle RF and then drug delivered inside. So this is easy, so no risk. Some might have some irritation, but I think it's less than 1 to 2%. So this is the. Okay. Can I go back? Sorry. Okay. If you look here, the needle go first, and then energy is delivered, and now after that, the drug is delivered. So someone is like worried that if you drug and energy comes together, if the drug is affected by some RF, maybe less effect because of the energy. But if you look here, energy comes first and then follows the drug. So you don't have to worry about that. It's not really simultaneous. It's like a step by step. So first energy and then drug comes. And also another good thing about this machine is that it has some. Okay, I think I'm not used to this one. It has some two depths of a needle. So one is 1.0 millimeter, the other one is 0.4 millimeters. So I think it targets papillary dermis and reticular dermis together. So it has a dual layer targeting RF. I don't want to talk about much about this machine because it's not from Junhan. So less. I'm just saying that you can use a different kind of microneedle RF with an element together to enhance the absorption of this product. So this is the guy that I treated in the movie, and after treatment, he got better with some redness and also with a good brightening. So the element is good with only 5 ingredients without any other substances that can cause any problem. And it has below 500 attom. So I think it's one of the really good best skin booster for skin brightening. If you care about brightening, I think this will be your choice. So I think you can use multiple delivery devices to enhance the penetration of this element to the skin. Thank you for listening.
Thank you very much, Dr. No, for